COVID-19 pandemic has caused huge disruption to society. We do want to commend people for having listened to the public health message and having stayed at home. We realise that this has caused some fear to individuals about presenting to hospital, and we have been aware that the number of people presenting with common cardiological conditions has dramatically decreased. As a group of cardiologists, this has caused us concern. We are able to treat common cardiological conditions very effectively with established treatments, but this treatment is time dependent and time critical, and that means that it's very important that we diagnose patients quickly and that we're able to instigate treatment as soon as we possibly can. This has caused us consternation or debate amongst ourselves about how best to deal with this, by trying to weigh up the risks and benefits of asking people to access health service at this time. And that's why we've introduced a new way of doing things.
So what we plan to do is to set up a new service that enables us for the patients to make contact with us, and they will contact an experienced cardiac nurse, and that cardiac nurse will do one of three things. They will assess their symptoms and reassure them that this does not sound cardiac. They will invite a person, if they do feel it sounds cardiac, to come and be assessed, and if they are worried and they feel that it's an emergency, they will advise that the patient will ring 999. The idea of the face-to-face assessment, to alleviate concern within the public, is to bring them here in a separate non-COVID infected area, so that it's a low risk area basically for patients. If it's out of hours, then the person will be directed towards the emergency department, but again in a non-COVID area to reduce risk to the public. But we feel that this is absolutely necessary because we're seeing regionally that there's been a dramatic reduction in the number of heart attacks, but people are having heart attacks and at home, and by staying at home with heart attacks, they are putting themselves at increased risk of complications and indeed of death.
Access to the experienced nurse will be a 24/7 service based on the nurse's telephone assessment, and if there's a need for the patient to be seen in an immediate time or in the next day, that'll be arranged either in the cardiac assessment unit in Noma Hospital or beside the cardiac ward in Altnagalvin Hospital. We wish you well throughout this period in particular, and we want you to know that we continue to be here to work on your behalf in this difficult